Hi, Dr. Punitha. How was your day?
Hi, Dr. Kshitija. I'm doing good. So, something new we are planning, right?
Yeah, because motto of Sora Dental Academy is always to keep learning and keep training. So
That's
we
nice, yeah.
thought
This
of
podcast is something very new for me also. So, let's try it out.
yeah, I thought of it's good to discuss small topics where we have interest and then which will help in our day-to-day practice. We'll
That's a
get
great
expert,
idea.
yeah, we'll get experts who knows what to do in this field, so that it is easier to connect people like this.
Let's try to make this more
Interesting.
interesting. So, what's the topic of today, Kshitija?
We'll start from basics. We don't want to go to hi-fi things like bone graft and all in initial podcasts.
That's true.
We,
I
as the
think
clinicians, we need to know how to interact with the patients and what the consultation is the one which is very important for anybody for
that's
that matter.
absolutely right. The first consultation is really, really important. So, why don't we discuss how to make our first consultation an impressive one? That's a good topic for start off.
Yes, yes. So, in your clinical experience, what do you think? You just get the patient, make them sit, take the mouth mirror probe, just check what are the cavities. You do like that?
That's actually most of the dentists do this, including me when I was practicing in my college or when I just passed out from college. That's what we used to do, right? As soon as the patient comes, rush them, make them sit on the chair and open their mouth and check. But over the experience, what I felt is patient actually doesn't like this way of treating them. So what I usually do is when the patient walks into my clinic, I call them inside, I make them sit, I make them feel comfortable. I ask them just normal questions like, "Hi, sir, what's your good name? How was your day? You had your breakfast?" This is the basic questions which you need to interact with the patient before taking them to the dental chair. Don't you think so, doctor?
Yeah, I think so because the whatever first impression is the best impression. That's what is everywhere. It
Absolutely.
applies everywhere.
Anxiety levels also really
Yes,
increase
yes,
if you just make them blindly, and most of the doctors don't even self introduce themselves,
yes.
right? "Hi, sir, I'm Dr. Punitha, I'll be the one checking you for the day." Nothing, just blindly make them sit on the chair and opening the mouth. I don't think that's a
It's a
good.
very brutal way, I think.
Yeah, first of all, patient has high scare and anxiety levels when they meet a dentist, and just taking them to the chair will, I think, increase their anxiety
First of
levels.
all our instruments are high sound and they look like some drilling,
Weapons,
carpentry
right?
works and everything.
So true, so
So
true.
it is very important for us to
Have a small conversation with the patient, make them feel comfortable, and then probably we can take over them to the dental chair and start off with the questions like, "Sir, why have you come to a clinic today? What is exactly your problem?" And then you can ask them to open the mouth and check the teeth. So, that's how you first make an impression with the patient.
So, how do you treat patients? You treat all patients in the same way, or you see that what kind of patients walk in and then think and understand the patient and then try to treat, or because it's very difficult to understand each kind of patients in the first
So
visit.
true, so true.
Yeah, you can't make
See,
a. We are not psychologists, right? So you see the patient
that's
face and
true.
then
So,
understand.
see, actually, there are various, as you say, there are various kinds of patients with different mindsets entering your clinic. So, you cannot generalize every patient and you cannot give one treatment plan for all the patients. So, it is simply like buying a car. There are more than 8 to 10 different brands in the market, right? Like Mercedes, there's Toyota, there is Maruti. So, every car will take from destination A to destination B, but the comfort each car provides, the luxury, the everything, it depends. So when I go to buy a car, I cannot say everyone will buy Maruti car.
Yes.
So it depends on their budget, it depends on what they want. So depending on that, they buy the car which the entire family wants, right? Similarly,
Some buy cars for luxury to show off.
correct,
Some buy cars for their
comfort,
comfort,
and
daily
some will be like
usage.
first car of their life.
Yes, even
So
house for that matter.
yeah.
For some wants to invest a lot of money on their interiors, aesthetics.
True, true, true. Similarly, see, with my experience of particular years, what I'm working, I have basically classified patients into five categories, okay, to make it very simple. First category is patients who demand immediate solution. So someone will walk in with, I have a pain, I have a swelling or something. They need immediate solution for that particular tooth. So it will be just a root canal or a particular tooth filling or bleeding gums resulting in scaling. So
Or
that's all will be their
simple,
treatment.
some people even wants just painkiller, like
Yes,
normal doctors, and this they want to leave.
correct.
They don't. That day's pain has to go.
That's it.
They don't
So
want to
that is the
invest
first
in.
category of
Yes,
patients who want immediate solution.
yes.
Second is, I feel, okay types. They want complete treatment, but again they don't want to pay more. They don't want to go for zirconia crowns, or they don't want other treatments to be done. So they are the second category of
So they want
patients.
only for the remedy to be corrected completely, like a root canal and a metal crown is enough for
Something,
them.
yeah.
For that too, they don't want to go for a complete.
Yes.
You say there is fillings here, fillings
Yeah,
there.
you
They
can't
are,
educate them about other teeth and they'll be least bothered to hear from you also.
yes.
That is second category. Third category is people who will totally believe in you and say, yes, I want complete health care from you. Okay, those kind of patients also walk in. But when we advise them, we tend to see that they don't get high value treatments like implants or FMRs. They don't agree for that. Of course, filling, scaling, root canal, caps, that is okay. But not like you go for an implant or aligners or something, they will say, no, no, that much I don't want to spend. This is enough for me. So that is the third category of people. Fourth is who get complete rehabilitation from us, including implants, dentures, crowns, bridges, everything. So these are this category of patients who completely trust the doctor. They say, you make my treatment plan, I have come to you. Finally, I want to walk out of the clinic with completely functioning teeth. So they are this fourth category of people. And the last category is who are totally concerned with looks and aesthetics.
They're not worried about their function. They don't worry
No,
about like.
they're least bothered whether I have molars, whether I have teeth to chew or nothing. They're not bothered about that.
When
They're
they,
bothered only about looks.
when they smile, it should be like a perfect smile.
Yes, that's it. So aesthetic concern is very high, and like we'll have to think about something zirconia crowns, layered crowns, lava crowns, smile designing. All these things we'll have to think while treatment planning is done. So this is the simplest classification actually I have done.
So what do you think is like you should call that particular kind of specialist for that kind of treatments, right? So depending on that thing, you call that kind of specialist.
Yeah. See, if the aesthetic concern is there, then we'll definitely have to call a good prosthodontist where they'll do a smile designing and things like that. If it is just an immediate solution where you can handle the patient, do the root canal, just send them. So that much you yourself can handle. So it again depends on the need of the patient. What do they need from us, right? So that's how I classify patient. But I want to tell you one very small funny incident. This happened to me, I think, 12 years back when I had started practicing, and I went for a internship with a very big dentist in Bangalore, and he had actually classified patients into A, B, C, D. And that time I had asked him, so how, like I had just come out of the college and I had asked him, so what is this ABCD classification? So he had said, A is a patient who walks into your clinic. So depending on that, the treatment planning has to be done. B is a patient who comes in auto rickshaw. C is a patient who has his own car. And D is a patient who comes actually in bus with an old bag and things like that. So depending on that, he used to change the ambience in the clinic, putting some light music, AC is on, and the consultation fee was also varying depending
Oh
on
my
this.
God.
But this was very funny, but somewhere I thought I should not learn bad practices in my life and learn something good. So he really gave me a lot of experience when I worked there for almost 6 months in his clinic, and that's when I understood there's actually a classification of patient apart from what we study in our textbook, right?
Yeah.
So textbook also provides us a classification, but I don't think when you come to practice that same classification can come into work.
No, that's what I understand. What I also see is like you can't charge bomb kind of treatments for every patient. You don't know, if you don't know their backgrounds, it's impossible to treat a patient. It's not like only dentistry you're handling. They have
Yeah.
their own problems in
Yes,
life.
most of my patients
And
literally sit for hours together and talk their family concerns with me.
that's good because you're a good dentist. That's why they talk to you. Because otherwise, it's not. If if you don't talk about it, then you don't know their problems.
Correct.
When you don't know their problems, you just want to see only the mouth. No, that is not the thing.
That doesn't work with us,
Yes.
Communication is the biggest key for us to make a good practice, and I believe investing in good time with each patient. So for me, every patient has become a family member over my 10 years of practice, and they completely trust in me. That's why referral rates are more. They refer their family and other friends also to my clinic. So if you don't invest time in each patient and just do mechanical work like open your mouth, check the teeth, do the treatment and send them, I don't think you'll be able to retain the patient for a longer time. There are more than 10 clinics in each street. So Bangalore is like heavily crowded with dental clinics. So if you want to be unique and if you want to stand out by doing something good in your practice, you should invest good time in each patient, and you need to know what patient wants from you. Depending on that, if you plan a treatment plan, I'm sure it will work out for you. Right,
Yeah,
doctor?
I understand. Because the thing is, first of all, dentistry is not a priority for so many of people in India.
Correct.
So you over that you first visit, you will tell like it costs you 15,000, 20,000. They were like, oh, this is too much. I don't want to invest in this.
That also have a funny thing. We have 32 teeth, right? So that's why people neglect.
Yes.
Even if 2 teeth go, it's okay. But if it's the same concern with kidney or heart, you have just 2 kidneys or just 1 heart, I'm sure they will run to the doctor, and whatever the doctor says, they get it done immediately. But it is not the same case with dentistry.
No, but people start to understand these things later in life.
Yes.
I've seen patients who have lost tooth, and then there's loss of VD and everything, and then they come back. See, I can't chew. I'm not able to live my life properly.
Correct.
And this is at an young age, so I don't know how we will continue my life. That is all things. which happen.
Nowadays, I think dental awareness has really increased, and people are coming for regular dental checkups every 6 months, getting cleaning done every 6 months. That's actually good, but I hope this will improve
Yes.
even more over a period of
No,
time.
the thing is, if we handle patients properly, I think patients will, if not today, they'll get the treatment in a later stage.
Correct.
Or step by step. You don't get it at a shot. Now you get the main, which is pain causing.
Concern,
Following 6 months, you can get it on another one. And nowadays, software engineers almost all have insurance from the office.
Yeah,
So,
insurance, credit cards, and there is this Arogya Pay, there is Bajaj Finance and EMIs and everything. So I'm sure dental treatments are becoming extremely affordable. It is just that they need to be aware that I need to get this done.
So we should be aware first that what are the things available. It's not like, okay, no, you pay now, I want it now.
Yeah, that should not be the way of talking to a patient.
You can't leave the clinic without you paying. And see, you should see. Yeah, there are patients who never pay, and then you have to be strict. That's why I'm telling you, each patient is different.
Yes.
So you can't force everybody.
You cannot generalize every patient. You can't put them in under a same bracket.
Yes.
It was a nice talk, doctor.
Yeah. So this is the first part of our first consultation. We'll come back with more things about first consultation, where you go, what kind of things you have to talk to the patient and everything.
So that will be in the next episode,
Yes,
is it?
next episode. So if any questions, you can comment in the comment section, and if any doubts, you can ask so that we can cover the questions in the next episode.
That's amazing, doctor. Okay, let's catch up again next time.
Yeah.
Until then, see you guys. Bye-bye.
Bye bye. Bye, Dr. Punitha.
Bye, Dr. Kshitija.